What's going on, y'all? Terrell Friday here at FutureDDS with another installment of the DSE series, season 2. Today we have Onalee Sortino from the State University of New York at Buffalo, School of Dental Medicine, joining us. How you doing, Onalee?
Hi, I'm good. How are you? Of
I'm doing well, man. Thanks for taking some time out and speaking with us.
course. Happy to be here.
Awesome. So if you could just reintroduce yourself and tell us a little bit about your journey into dental school and where you are now, like where you went to undergrad, what you majored in, as well as what year you are now.
Yeah. So my name is Onalee. I'm a second year student at University of Buffalo School of Dental Medicine. I am from Rochester, New York originally, so pretty close to Buffalo. I went to Allegheny College for undergrad, which is a really small private school in Pennsylvania, like about hour and a half north of Pittsburgh. I majored in biology, minored in French and music. I play the flute, so nerdy thing.
Nice.
Um, yeah, I'm 23 years old. I did not take a gap year. I went straight from undergrad to dental school and happily residing in Buffalo now.
Nice. Did you always know you wanted to be a dentist?
I did. So I knew I wanted to be a dentist since I was 6. I had always told my mom it was my favorite 2 days of the year was to go to the dentist. And then I guess that just traveled all the way through.
Nice, it worked out. So you found it early.
It worked out.
Okay, so this is the burning question that all of the pre-dents out there, I'm sure, are dying to figure out is what did you use to get the score? To get you into dental school. What would you use to get that score in the DAT?
So I studied for 2.5 weeks before, which is not what I would recommend. But if you do that, you have to study really hard.
Yeah.
And I did a lot of practice questions. So I would find any free practice test that I could, and I would go through the entire thing. I know sometimes some people don't recommend doing that many because it burns you out, but I found that was the best way to prepare me was to just do full length practice test after full length practice test and get used to the questions. And then afterwards I would review them and I would see what questions I got wrong and what the answers were that I didn't understand, and then make flashcards. So that way I could go over it again and again and again until I got all the terms down. And yeah, overall it worked out. I won't say that I did the best on the DAT, but I did well enough to get in, and some of my scores I was really proud of. And I think that you don't have to get a 23, 25 AA to get into dental school as long as you have, other things that make you stand out. But yeah, so just do a lot of practice questions. I didn't buy any of the expensive programs. I bought a $50 Kaplan Blue Book, and I looked at it a couple times, realized I didn't like studying on paper, and then literally just did free online things, and that's it.
Got you. That's big too. People do like drill a whole bunch of questions, but it's key to go back and really like understand the other
Yeah.
answer choices, even if you got it right, because you
Yeah,
can easily ask a question about any of those other things.
exactly. That was definitely the biggest thing, was going through every single answer choice and understanding why it was there and what that meant, just in case I saw the word pop up again or something.
For sure. So, anyone specifically looking at Buffalo obviously is going to try to, get a leg up or just get some more exposure to that school. Do you guys have any type of pre-dental or feeder programs for prospective students there?
Yes, we do. So part of ASDA, the American Student Dental Association, is our pre-dental portion. So we have officers in the dental school that are committed to reaching out to prospective students and giving them like online tours, or bringing them into the school and showing them what's going on. And then we also have pre-dental events. So they try to plan one at least once a month.
Mhm.
We have suturing workshops
Right.
in B30, which is our preclinical simulation center, where we get a whole bunch of students from first year to fourth year to volunteer, and that we bring in pre-dents and we show them how to suture. We
Nice.
have soap carving. We have a lot of different things, a lot of tours and stuff. So definitely always opportunities. And if you reach out to anyone in UB ASDA, go on the website, they'll definitely put you in contact with that.
Nice. So, this is interesting. We were talking a little bit before we started the interview, but how was your actual application and interview process? So how was that whole application process, deciding what schools you're going to apply to, and then ultimately how was the interview at Buffalo, and that made you choose there?
Yeah, so I originally thought that I wanted to take a gap year, so I didn't plan to apply in my junior year of school. And then at the end of the semester, I decided, you know what, I'll apply to my number one school, which was Buffalo, and I'll take the DAT on a whim, which is why I only studied for 2.5 weeks. Like I said, don't recommend that. And I would apply only there. So my application, I spent a long time on my, personal statement. I thought that was really important, was making my writing stand out since I knew that my DAT score wasn't the absolute best. And I did the supplemental for Buffalo, and I applied in mid-June. I got my application in, and I got my interview request in August for the first round of interviews for UB, which was great. I had planned a DAT retake actually because I thought that it wasn't good enough, and then decided to cancel it once I got my interview request. So that worked out for me. I interviewed in September. It was 85 degrees out and I was wearing a skirt suit. I was very warm, sweating. Not a good look, but it was okay. So the way the interview was set up was there were 20 of us in a room sitting at a round table, and you kind of sit there and talk to the other students for most of the prospective students for most of the time while you're waiting for your interviews. And they do 2 one-on-one interviews with faculty, and then they give you lunch with current students, and they give you a tour of the building, and then afterwards they give closing remarks from the dean of academics, the dean of student affairs, and the clinic dean. So my interview was with the dean of student affairs first.
Wow.
And not everyone gets interviewed by him, but I was picked to. And he asked me, what do you do if you get multiple acceptances? And I said, I only applied here, so that will not be an issue, because if I get accepted, I will be coming here. Don't you worry. And yeah, he asked me why I wanted to come to Buffalo, what I thought the pluses were about the school. So I gave him all of what I thought about that. Overall, I liked the interview day. I thought the people that I was around were really nice. I'm actually roommates with one of the girls now. So that was nice. We both got accepted. And overall, yeah, it was pretty chill. Just having the 2 faculty, they try to make it comfortable for you. They know everyone's stressed out, everyone's nervous, everyone wants to get in. Really just take a deep breath. Yeah, Buffalo was super good about that. And the current students that we ate lunch with were just very off the book pretty much. They just wanted to give you a real idea of what happens at Buffalo and how they like it. They want to have real conversations with you and not the same conversations that you've had 600 times about why you want to come to dental school.
Of course.
So that was interview day for me. And then I got my acceptance December 1st, and that was that.
That's all she wrote, man. Nice. Perfect.
Yeah.
It worked out perfectly for you then.
It did.
After you finally got your acceptance and, you surprisingly get into school after you didn't think you would. But how was that first year for you? How was the curriculum laid out, and then how were you guys introduced into the pre-clinic clinical aspect of dental school?
Yeah, so I'll be honest, I think that there are a little bit too many didactic classes first year, things that you had to take already to get into dental school. Like, not everyone took micro, but like biochem, that was a big one that we all took, and we were like, why are we still taking this when we've already done it? I'm not going to use this again, if you do research maybe, but
yeah.
So I didn't like that much. We take histo our first semester, histology. I struggled in that class. That was definitely my hardest class, and I was someone who didn't really study in undergrad. So coming to dental school and actually having to make that transition was a little bit tough for me. And I didn't do that well on the first exam, but then just studied really hard. I told myself that there were a lot of classes, but I had to put more work into certain classes that I was struggling in than others, because I don't want to get a C or fail in classes.
Right.
So it was a transition for me, but I managed and ended up doing well, my first year. We start pre-clinic our very first semester. We have a preclinical skills course taught by Dr. Ronnie. Not that any of you know who that is, but she's a great woman. She's now my research advisor also.
Yeah, hopefully people will soon know who that is.
Yes, hopefully people will know who that is, yes. And so you pick up your handpieces, mainly your high speed, and they give you little plastic teeth that you put in type it-ons and put in your simulator. So it's like you're treating a real patient, and you prepare circles and strips, and then you scan them into a computer using an intraoral scanner by Plan Mecca, and then you compare it to a master preparation. So you could see how deep you are versus their master preparation, or how shallow. You could see if your walls are convergent or divergent. So that was a really cool thing, was because I would look at a preparation and I would say, this looks okay, I don't really know. And then I would put it in the computer and see, oh, this wall is actually leaning like this. And then I'd look back at my preparation and say, oh, I see that now. So that was awesome that we got to do that first semester. And then second semester, we take direct restoration. So we do resin. So you start class 1, class 2, class 3, class 4, class 5, all of those preps, doing that. And you do them all on plastic teeth. You don't treat real people or anything. You have the practicals, and I would say they prepared us well for that. I definitely felt like my hand skills were shaky at first, but the first course is pass fail. So as long as you get your projects done and you take the final competency, you will pass the class, and then it's just all about practice. So early assimilation with the hand pieces, and then clinic, we start in our spring semester rotations assisting the upperclassmen. So you mostly suction and you grab materials for them, and they just talk you through what they're doing. So it was cool to see. You have just rotations in normal. You don't get rotations through endo or oral surgery until your second year. But now I think that's beneficial because I know more. So I'm glad that I'm doing it now. And you also continue to assist your second year as well as see patients. But
Gotcha.
Yeah. So that was first year for me.
Cool. So the last few questions, we're gonna start wrapping up here. So I know you only have your one dental school experience, but what is something unique about your experience there so far? So after over your 2 years so far.
Yeah, I think how close we are with our professors is a big one. When we hold events, our professors come to them and we interact with them like they're our friends. So we have a very big community service outreach program, BOCA, and we hold a gala for that, which is kind of like a formal, but more formal than that. And it's all to raise money for BOCA to bring students on outreaches across the country. And the professors auction off things for us. So they'll auction off like a dinner for 5 students, and then bowling, and then we bid on it and we pay money. And it's really cool having your professors like want to get to know you and want to be friends with you. I feel very comfortable with all of them, and I think that's a really great thing about Buffalo.
Nice. So the last question to wrap it all up is, if you could go back in time and tell the younger version of you while you were still applying to school or still thinking about applying to school, any words of advice, what would those words be?
It would be take more time to prepare, because I did get in, and I'm of course very happy about that, but it made it a little stressful. So take as much time as you can to prepare. Make sure I write a good personal statement and have people proofread it, since that's big. You don't want to blow off the application at all. And just at the same time to relax, because if you are yourself, your personality will shine through in your interview, and they'll see why you should be accepted, and that's really big.
Nice. Awesome. Couldn't say it better myself. I'm sure everybody out there, all the viewers, all the pre-nets watching, gained some really valuable information from you, some really good gems to go by. But yeah, thank you again, Onalee, for taking some time out and speaking with us. But anybody has any questions for you, specifically about UB or about your journey into dental school, or just any questions for you in general, man, what's your Instagram so they can get in touch with you and send you a DM?
Yeah, so my Instagram is at Onalee. It's at ONALEELEE. And anyone is welcome to talk to me at any time, especially now that we're here, online classes, home all the time. I'll love to answer some questions.
Man, so is this like, I guess coronavirus, is it really affecting your guys' second year?
So it affected our lab classes with indirect and removable, and endo. It definitely affected our projects. We can't do them for now because we're out of clinic and pre-clinic. They plan to bring us back April 6th, but that's pretty shaky as of now. It might not happen. So we might have to figure out different things when we come back over the summer to finish out our classes. But for didactics, everything's online now, and we have a new software to take tests. So nothing is changing with that. Just a new feel, adapting.
Yeah, same. Well,
Yeah.
again, thanks again, Onalee, for sitting down with us on behalf of the Future DDS family, all the viewers, all the pre-dents out there.
Yes, thank you. Thank you for having me. I'm very happy to be here.
Awesome. For everyone out there who hasn't already, make sure you hit this like button, the subscribe button, and the notification bell so you know whenever we post up new content. But until next time, that's going to be it. See you guys.